Responsible Restart Ohio for consumer, retail, services, and entertainment. Mandatory practices for employees are as follows. Ensure minimum of 6 feet between employees, if possible. If not possible, install barriers. Businesses must require all employees to wear facial coverings, except for one of the following reasons. Facial coverings in the work setting are prohibited by law or regulation. Facial coverings are in violation of documented industry standards. Facial coverings are not advisable for health reasons. Facial coverings are in violation of the business's documented safety policies. Facial coverings are not required when the employee works alone in an assigned work area. There is functional or practical reason for an employee not to wear a facial covering in the workplace. Businesses must provide written justification to local health officials upon request, explaining why an employee is not required to wear a facial covering in the workplace. At minimum, facial covering or masks should be cloth or fabric and cover an individual's nose, mouth, and chin. Strongly encourage as many employees as possible to work from home. Employees must perform daily symptom assessment. Require employees to stay home if symptomatic. Require regular hand washing by employees. Place hand sanitizers in high contact locations. Clean high touch items after each use, for example, carts and baskets and other items and equipment. Reinforce key messages. Stay home when sick, use cough and sneeze etiquette, and provide hand hygiene to all employees, and place posters where they are most likely to be seen. Provide protection supplies such as soap and water, hand sanitizer, tissues, and no-touch disposal receptacles for use by employees. Mandatory practices for customers and guests are as follows. Ensure a minimum of 6 feet between customers when possible. All customers and persons in or on the premises of the store must wear a facial covering or mask at all times. Specify hours of at-risk populations as appropriate, for example, the elderly. Place hand sanitizers in high contact locations. Ask customers and guests not to enter if symptomatic. Stagger entry of customers and guests. Mandatory practices for physical spaces are as follows. Ensure a minimum of 6 feet between people if possible. If not possible, install barriers. When possible, designate 6-foot distances with signage, tape, or by other means. Post social distancing signage and disinfect high contact surfaces hourly. Use alternate registers. Frequently wash hands with soap and water for at least 20 seconds or use hand sanitizer. Cover coughs and sneeze and do not shake hands. Clean merchandise before stocking if possible. Establish maximum capacity. Comply with all applicable social distancing guidance from the U.S. Centers for Disease Control and Prevention and the Ohio Department of Health. Mandatory practices for facial coverings in retail establishments. Retailers, defined as stores, retail businesses, and/or other enterprises that sell goods in person to the public, must adhere to the following. Require and ensure that all people on premises wear a facial covering at all times, except children younger than 10 and people medically or developmentally unable to wear one. Provide reasonable accommodation to any person unable to wear a mask by providing online or telephone ordering and curbside, non-contact pickup or delivery, or allowing a full face shield. Post face mask required signage and signage describing accommodations for people unable to wear a mask at all entrances of all retail areas. Post on the retailer's website, if any, the details of accommodating people unable to wear a mask. Post at all entrances and enforce limited maximum capacity. Limit and stagger people to assure a minimum of 6 feet for physical distance. Arrange all store aisles to be directionally one way if necessary for social distancing. Designate an on-site masking compliance officer each location and shift. Allow access and inspection during business hours by public health or law enforcement representatives. Provide requested information on masking compliance. Cooperate fully in any masking compliances, inspection, or investigation. If issued a notice of violation, retailers must immediately close to the public for a period not exceeding 24 hours. A warning not requiring closure will be issued for a first offense. Best practices for confirmed cases. Immediately isolate, separate, or send home and seek medical care for any individual who develops symptoms while at work. Contact the local health district about suspected cases or exposures. Shut down shop and floor for deep sanitation if possible. Recommended best practices for employees. Group employees by shift to reduce exposure. Recommended best practices for customers and guests. Use a health questionnaire to check people for symptoms at entry point. Provide face coverings upon entry. Where possible, accept customers by appointment only. Increase availability for curbside pickup. Consider suspending return policies. Recommended best practices for physical spaces. Close once a week for deep cleaning. Add designated markers encouraging customers to stand 6 feet apart in checkout lines. Use contactless payments where possible. Increase capacity for delivery and curbside pickup. Recommended best practices for confirmed cases. Work with local health department to identify potentially infected or exposed individuals to help facilitate effective contact tracing and notification. Test all people suspected of being infected or exposed. Following testing, contact local health department to initiate appropriate care and tracing.